today and agreed to give a talk on a title which is very interesting and also topical, how Ayurveda can contribute to global health. And as you know, we have just concluded the Bali G20 summit at Bali. And the declaration has a lot of concern about public health, about the impact of COVID on global health, and a number of initiatives have been talked about. So, how the traditional health systems, which are there in our country and also in many other countries, how they should be rejuvenated to bring about this the जो है ना लक्ष्य है हमारा कि everybody should be healthy, and as our Vedic prayers also talk about Sarve Bhavantu Sukhina, Sarve Santu Niramaya, everybody should be healthy. And now in our G20 presidency, which we have now for the next 1 year, we must come out with some new ideas. And I think because of the importance of global health and also the great deal of interest in traditional systems of healing, and particularly from the International Yoga Day that we are now celebrating for the last several years, there is a global interest. But I think we should not just limit ourselves to just the yoga. I mean, India has a lot to offer. And the Ayush Ministry, I think, has done a wonderful job in terms of promoting and also putting some resources in these health systems. But a lot of work still needs to be done. Although I was seeing some figure somewhere, I may be wrong, but I think the figure said that the 80% of the world's population still depends on non-traditional or rather traditional methods of healing and well-being and healing systems, traditional healing systems. But somehow they are regarded as somewhat secondary or even inferior, and people always go for allopathy. I think the reason being that one is that there's not enough awareness, particularly among the elites, because it's the elites who govern a country, and they are the people who are in charge of policies, etc. So we have to spread that awareness. That is one. Secondly, I think not enough resources are also being devoted to promote these systems. And today, when we have these new technologies and huge access to data analytic techniques, etc., I think the traditional systems should also adopt the modern methods, particularly do something in research and development and awareness. So there are several things that can be done, but here is an expert today, Dr. P. Rammanohar, who will be speaking to us about Ayurveda in the public health, global health. And just a brief introduction of our distinguished speaker. He received BAMS degree from Bhartihar University, Coimbatore in 1991, and MD degree from Rajiv Gandhi University of Health Sciences, Bangalore in 2001. He has been contributing to the field of Ayurvedic research since the last 30 years, and his publications include research papers in index journals and chapters in books. So he's a researcher in Ayurveda, and I think his perspectives will be very important. And he has also been honored with a number of prestigious awards over the years, and there are a number of them that have been here. I don't want to mention them because that will take away from our time. But enough to mention that he has visited in his connection with his research. He has visited several countries, including United States, United Kingdom, Canada, Argentina, Brazil, Germany, France, Netherlands, Italy, Austria, etc. It is a long list of countries, including in our neighborhood, Thailand, Sri Lanka. And these visits were undertaken for the promotion of Ayurveda. So he's well versed with the global scene as well. So not taking more of your time, I now request Dr. Rammanohar to kindly take the floor. So he could speak for some time, maybe 40 minutes, 45 minutes, and then we'll devote maybe half an hour for Q&A. I'm sure there will be a lot of curiosity and questions. And we'll be very happy if you could also contribute to the VIF's effort to get this integrated system, integrated thinking as far as health is concerned, and also integrating this, allopathy, homeopathy, Ayurveda, Unani, and some others, at least raise awareness about it. And we'll be very happy to make a group of people who could discuss it. During the COVID, we have had about 2 or 3 such seminars. We got some doctors who could speak with each other, and it was a useful interaction. But we like to take this forward. We also had the people, I think, from the Ayurveda Institute of Ayurvedic Sciences. There's one in Delhi.
Yeah, All India Institute.
All India Institute. So there's, I think, a joint director was here with us. So we'll certainly like to take these initiatives forward. But certainly in the context of the next 1 year, which is the G20, if we can put forward some new ideas, there are several, apart from the official groups, there are several non-official, unofficial groups also, engagement groups they are called, that have been set up. And there is one group of civil society, for instance, there is a think tanks group, there is a religious society, religious organizations group, and many others like that. So maybe some of these ideas we could also introduce to these groups, and then they could come into our G20 discussions. And as you know, India would be holding the summit sometimes in September. So before that, we could do something. So these are a few practical suggestions also, but we can discuss them. And over to you, Dr. Amno.
So namaste to everybody. I'm really honored to be here today to share some thoughts on how Ayurveda can power the development of a global health culture. And I'll just share my slides in a moment. At the outset, I'd like to point out that, in the limited time, I'd like to be very clear on what I'm going to focus today is, the world is going through a health crisis, and it's a paradoxical situation. On the one hand, we are making significant progress in medical science and technology. But on the other hand, we are also grappling with, innumerable health challenges that seem to be coming up anew every day. And a very interesting trend that is happening world over is that this is renewed interest in traditional systems, alternative systems of healing. And it's quite diverse. I mean, when we think about integration, it's not just, integrating one system like Ayurveda with modern medicine. When you look at alternative systems, there's quite a lot of diverse approaches there. And I'm reminded of a statement in the Charaka Samhita dating 3000 years ago, where Charaka is talking about medical pluralism. Vividhani hi shastrani bishajam pracharanti loke. And there's so many approaches to healthcare that are prevalent in the world. And how do we choose, from them to which is the best? So we are also moving towards an emergence of pluralism. And while the integrative movement is trying to absorb what is, quote unquote, scientifically validated into the mainstream medicine, I think this is also going to be not a complete healthy way to move forward, because the modern medicine has a reductionistic framework, and the integrative medicine movement that is emerging in the West is something in which scientific validation using Western scientific parameters is a criteria to accept what is, valid and what is not valid. And this is where I think Ayurveda can offer. What we need today, in my opinion, is a meta framework, a framework that goes above, evaluation of one system against another. We need a very inclusive, accommodative approach. And I like to present Ayurveda as, a system that can provide this meta framework to integrate and bring these pluralistic healthcare systems in a very organized and coherent manner. So that's going to be the focus of my talk, because we need all these systems. That's what we have learned. All of them offer different ways to understand the human body. The bottom line is that human life is complex, the human being is complex, and there is no one single map. It's like when we try to understand about ourselves, our lives, and especially when it comes to humans, it's complexity all the way. And it's like, the map is not the territory. I mean, whatever ways we model and we map what is there, in our experience, it becomes incomplete. So what we need today is a dimensional, meta framework perspective on what is health, disease, and the human being. And Ayurveda, I believe, in my experience and understanding, is one of the earliest systems which attempted to create such a framework for healing. So with these opening words, I'll get into my slide. Please confirm that it is visible.
Yes, you can see that. Yeah, thank you.
So this is the title, and just a little bit, of introduction before we go into the heart of the topic, is that Ayurveda is also a bit difficult sometimes to define. Ayurveda comes from two words: life, ayus, Veda, knowledge, and so it's a knowledge of life, or life becoming aware of itself. That's how Ayurveda defines itself. It's more than a medical system, more than even a healthcare system. It's a complete vision on life. And I'm very much happy to see that we have preserved this terminology. Most of the traditional systems have got new terminologies. Like, Chinese system is TCM, traditional Chinese medicine. You have traditional European medicine or African medicine. It's I think it's a good thing that Ayurveda is still called as Ayurveda and not, traditional Indian medicine, because the Ayurvedic outlook is very universal and global. And I think this is one very important thing that Ayurveda can contribute. Is we know that worldwide there is traditional medicine. In fact, Ayurveda texts point out that whenever there is biodiversity and human interaction with that biodiversity, Ayurveda will emerge out of that interaction. That is why it is called as life understanding itself. So Ayurveda, according to our texts and tradition, is present everywhere in the world. Wherever there is life, wherever there is human being, and wherever there is this interaction with the biodiversity around us, there is Ayurveda. This is true of the word Sanskrit also. And actually, I learned this from a professor in London in a school where they teach Sanskrit. He says how Sanskrit has a universal appeal. All languages are known by the land where it is spoken, almost mostly, like England, Britain, English, German, Germany, even Hindi, Hindustani, Tamil Nadu. But Sanskrit, it's Sanskritam. It's something, it's refined speech. It's not linked to any particular geographical location. So Ayurveda gives us that universalism, even in the very way that terminology has been coined. None of our texts ever talk about Bharat or just one particular region. It's all about life in its totality. Life wherever it exists, Ayurveda is concerned about it. And another interesting aspect is the antiquity of Ayurveda. I mean, time travel to the distant past is impossible, and the origins of Ayurveda are lost, in the midst of time. And this is very fascinating. Ayurveda. This is why Ayurveda says that the origins of Ayurveda is from time immemorial, and by even the most conservative estimates, it has been around for at least 1,000 years before the Common Era. And a tradition, and this is very interesting, but what Ayurveda says is, how can you trace the origin of a system of knowledge that coexists with life? It's as old as life itself. And we cannot also trace its origin to any particular geographical region. I mean, we have to trace it to the origin of humanity itself. I find this as a very refreshing narrative where the texts say that, Ayurveda originated from Brahma, and who is Brahma is nature itself. The ever expanding. Braha means to grow, and from Brahma it comes to Prajapati, Indra. These are all, the natural principles, and Brahma is said to have created the knowledge of Ayurveda in, infinite number of slokas. In fact, as we decode this narrative, we understand that Ayurveda, to learn Ayurveda, we have to read the book of nature. It's not traced to any human being. The knowledge of Ayurveda is present in nature itself, and so anybody anywhere in the globe has the potential to, discover it. The only thing we claim is that this knowledge was systematized. And the Ayurvedic texts also clearly talk about various cycles of its discovery and then its disappearance and then rediscovery. So it is mentioned that in the human mind, it may not sustain for long. So the textbooks say Avabodha Upadesha, that every time it is cognized, then it is transmitted, then it just fades from our human memory, and then it has to be rediscovered again. So we have a very universal outlook and a very rational perspective on the origins of Ayurveda, and they don't want to really trace it to any single human being or a single tradition. Uh, Having said that, there is also the Ayurvedic view that this has its roots in the Vedic tradition, and it has emerged through a rationalization of the ritualistic practices. And many Western scholars have pointed out that Vedic medicine was ritualistic, but Ayurveda is more rational. So Ayurveda could not have emerged from the Vedas, and that so it is its origins in Buddhism. It has become fashionable also amongst many Western scholars to uh, provide antithesis to certain deep-rooted traditional concepts. This needs to be examined. But what I can point out at this juncture is why I brought this topic is that Ayurveda represents definitely one of the earliest attempts to create a framework of rational medicine, which Ayurvedic texts call as Yukti Vyapasharaya Chikitsa. It's based on Yukti or rational reasoning or understanding of cause and effect relationships. So Ayurveda is said to be based on Hetulinga Aushatham. This is the Trisutra, it is called, that, for every disease there is a cause, Hetu. And every disease manifests through lingas or, a clinical presentation. And according to the Hetu and the linga, you have to give the Aushatha or the medicine. So this was a very big step in rationalization of medicine, that for every, nothing happens randomly. For every disease there is a cause or a multiplicity of causes, and it presents in a very distinct way as a disease. And if we, without understanding the etiology and the clinical presentation of the disease, you cannot treat a disease. So this has its origin in the Vedas, because in the Vedic tradition also we have the Karma Kanda and the Jnana Kanda. So one of the Ayurvedic textbooks say that Ayurveda emerged out of the process of, liberating ourselves from, this attraction to rituals. From ritualistic medicine emerged a more rational form of medicine, and Ayurveda represents that transition. So Kashyapa Samhita says that Ayurveda emerged not just simply from the Vedas, but from the Upanishadic part of the Vedas. So just like the Upanishad is the Jnana Kanda of the Veda or Vedanta, similarly Ayurveda represents. So it's one continuity. We had those ritualistic practices, and one interesting thing is Ayurveda has not given up the ritualistic element of healing. Ayurveda insists, and this is also coming back in Western medicine. In fact, Ayurveda points out that the very process of healing is indeed ritualistic. We can rationalize it, but we cannot completely come out of it. Even modern healing has now become, it is a ritual in its own. There is what we call as the psychological effect of healing. There is the placebo effect. All these things are completely inescapable. So Ayurveda came with a framework of 3 approaches to healing, which it calls as Daiva Vyapashraya. That's not there in the slide. It's just something which I thought I must point out also at this, at this point of time. Daiva Vyapashraya, Yukti Vyapashraya, and Sattva Vijaya, which means Ayurveda accepts all approaches to healing. It accepts religious practices, accepts spiritual practices, but then places them in the right context. And I think this is very, very important today when we are thinking about a global system of healthcare. How do we accommodate all these? What is the role of prayer? What is the role of belief of an individual, in the process of healing? Ayurveda does not want to ignore that, even though it sticks to rational system. So Ayurvedic text would say, when it comes to rational healing, it doesn't matter uh, who makes the statement or who gives the treatment. But there are also subjective elements of healing where the healer is very important and that cannot be ignored. So today we are also seeing modern studies on how prayer affects healing, how faith, changes the whole outcome in diseases. So it's heartening to see that Ayurveda still holds on to what was, beneficial and useful in the old framework of healing. And another thing is that Ayurveda is not just for humans, it's also for animals and plants. So we have Riksha Ayurveda, Pashwa Ayurveda, and Hastya Ayurveda. So it's for the whole living creature. So that Charaka Samhita clearly points out. So I think this is very relevant today because this is in alignment with this emerging theme of One Health, environmental health, human health and animal health. And Ayurveda goes even beyond that into, because the whole cosmos is one living organism. And we believe that unless the cosmos is in harmony, we cannot achieve, individual harmony. So our idea of One Health is even more comprehensive, but aligns well with this concept. So Sarva Bhutanu Kampaya. It's nowhere in the text it is said that it is only for humans. Sarva Bhuta, the entire universe, the whole living beings need to be in harmony for us to discover harmony. In fact, Ayurvedic texts very clearly say that if there is a stress anywhere in the universe, that will also reflect in the individual. So our prayers, it's a selfish prayer when we say that everybody should be happy, because without that we cannot become happy. So it's also, there is a pinch of selfishness there, because the stress in anywhere in the universe can adversely affect us. And when it comes to the scope of Ayurveda, people today are talking about Ayurveda for wellness, but in my opinion, Ayurveda is an ideal balance between prevention and cure. There is also curative element. So it is not correct to just push Ayurveda as wellness. In fact, what Ayurveda can bring us is that right understanding of where is the boundaries between preventive and curative care. How much should we invest? Where should we invest on curative care, and what should be the emphasis on prevention? So we have in Ayurveda a branch called Swasthavritam, dealing with prevention and promotion of health, and also a branch that deals with management of diseases called Athuravritam. And Swastha, it's very interesting. This is another thing. Ayurveda gives a very comprehensive definition of health that goes way beyond even what the WHO has conceived. So in Ayurveda, Swastha means to be established in oneself. And one of the definitions is also at a psychological level. I mean, if an individual cannot discover a means to be happy without any reason, this is ultimate test of health, being happy without any reason. And definition of health is multidimensional: balance of digestion, physiological functions, metabolism, excretion, peaceful mind, proper functioning of the sense organs, an expression of a higher consciousness. This is very, very important. Today we talk about spiritual well-being, but how do we define it? Ayurveda says that the human being has to evolve to higher levels of awareness, which is a sign of, higher levels of health. So this is an even more comprehensive definition of health than proposed by the WHO. And now we are working on a project called Arogya Samskriti, where this is a Ministry of Education funded project that we are working on. We have come up with very interesting findings on what is the health information available in non-Ayurvedic Sanskrit texts. And we find it, there's such a rich information that health awareness dissemination was done in ancient India through all kinds of literatures. From Vedic Laukika literature to Vedic literature, health was given such importance. And this word cloud that you can see here represents some of the topics that are actually discussed in non-Ayurvedic Sanskrit texts. In fact, we found that a lot of health information, especially for preventive health, are sometimes discussed in greater detail in non-Ayurvedic textbooks, than even in the classical Ayurvedic texts. So there are even topics like, addiction, alcohol, hunger, thirst, food diversity, healthy culinary habits, healthy sexual lives. All these things were disseminated through poetry, even in textbooks on economics. Wherever health is important, they refer to that. So we can say that India represented what we can in Sanskrit call as a Arogya Samskriti or healthy culture, which is in alignment with the UN SDG 3. The Ayurvedic concept is that how do we promote a healthy society? It's not by health for all. Health for all was one of the slogans of the WHO when we were students. But in 2000 AD, we had AIDS and other such pandemics. And now we talk about universal health coverage. Everybody should get access to healthcare. And in 2020, we experienced COVID, and the countries with access to best healthcare suffered the most. So, it's not just universal healthcare. What Ayurveda says is health intelligence for all. Arogya Buddhi. What we need is health intelligence. Health is not something that can be distributed. Health awareness has to be created. Until that happens, so Dhanvantari is actually an individual who has developed this health intelligence. Worshipping Dhanvantari in Ayurveda is awakening health individuals in all human beings. So, and when it comes to curative medicine, Ayurveda was very specialized. We have, I think this is not even recognized. Like pediatrics, today we talk about some Western pediatrician who developed the branch of pediatrics a couple of 100 years ago. 3000 years ago in ancient India, a textbook was written on pediatrics called Kashyapa Samhita, which is not available in its complete form today. We have lost much of this information. At least 8 major branches and subdivisions were there. There's a whole rationale behind these 8 basic specializations of Ayurveda, which I'm not going into. So just to give a indication, internal medicine, pediatrics, ENT, dentistry, ophthalmology, psychiatry, surgery, toxicology, immunity and aging, reproductive medicine. These are all some of the major branches. Now, when it comes to curative medicine, in my understanding, one of the major areas, and this is going to be very significant, the burden of non-communicable diseases, where Ayurveda is very strong. What we hear from statistics today is that 70% of global morbidity and mortality is attributable to non-communicable diseases like heart disease, cancer, respiratory diseases, diabetes. 70%. If you can reduce this burden, a major problem of the modern world is solved. And Ayurveda can significantly contribute, not only Ayurveda, but other, traditional systems also. And while heart disease is the number one cause for mortality, in the US we have statistics. Number 2 is cancer. There's a typo here. The third leading cause is medical intervention, or doctors are said to be the third leading cause of mortality and morbidity. I mean, this is extremely concerning, and this is a gap that we need to really, focus on. And there are studies which have showed, especially in very developed countries where there is more access to medical facility, when doctors went on strike, the mortality plummeted. I mean, it reduced significantly. The mortality was reduced in many developed countries. Maybe in India, it may not be the same because we are still struggling with, infectious diseases, emergencies, and things like that. But in most of the developed countries, over medication is a problem. Now, if you look at the textual tradition, so in order that Ayurveda comes to its full potential, there is a lot of work that we need to do. And this I call as making Ayurveda contemporary. We are still, there is a lot of confusion that have happened. When you think about Ayurveda, we think pure Ayurveda, authentic Ayurveda, or, classical Ayurveda is the way Ayurveda existed, before the colonial period. From the classical perspective, pure Ayurveda is not, time travel 200 years ago. It's actually traveling forward. Ayurvedic texts clearly tell that Ayurveda is a knowledge system organized on 3 pillars like Tattva, Shastra, and Vyavahara. Tattva are the core principles, which are, the laws of nature as such. And the more closer we understand that, the more we are able to, bring out a strong medical science. Then we have the Shastra. Shastra is the human understanding of these tattvas. We create the sciences, we create the models and paradigms. That is Shastra. And then we have the Vyavahara, which is the application. So if you look at the whole tradition, that is what I've shown here in this picture. And I've just made it very representative because you can see the whole length and breadth of our country is covered by these representative texts. And in the cross section of a tree, the annular rings are seen that represents time. So chronologically and geographically, the whole country participated in updating Ayurvedic knowledge and making it relevant for that time and space. And this is something that has stopped, from the colonial period. And now all that we do is try to preserve, like what we are doing is making a museum of Ayurveda, trying to preserve the way it was practiced maybe 200 years ago. And that is a very big impediment. If you look at the tradition, we need to modernize, we need to go forward. We can create a new shastra. Only the tattvas don't change. The vyavaharas or practices have to change. So this is very, very important. So here, actually, many of these manuscripts are still not studied. One estimate says that of the whole science manuscripts in India, less than 10% have actually been studied or printed or published. 90% are still languishing in manuscript libraries. So this is the heritage we are sitting on, a lot of which was lost, like the Kashyapa Samhita or Bela Samhita, where circulation of blood is mentioned. That Samhita is not available in a full form. But what about the 90% of science texts that are still there, which we have not bothered to study or digitize or bring into, a machine readable or readable format? So here, if I were to place all the manuscripts that were available, we wouldn't see the topography of India. I mean, the whole of India would be covered by the pile of manuscripts. We have so much of medical literature. India is one of the richest medical literature in the whole world. And there is a big gap between oral tradition and practices. Everything that was practiced was not always written down. So it's also very important to salvage what is remaining, what has been preserved through oral traditions, through traditional practitioners. The oral tradition carried one half of Ayurvedic knowledge, written tradition carried only the other half. Without the guru, without the transmission, you wouldn't be able to decode a text completely. So this transition from oral to written tradition, today, even now, it is possible to salvage a lot of this knowledge, a lot of the folk traditions, tribal practices. Many of them have got distorted, but a lot of these old knowledge is still, preserved. And only when we bring, so the knowledge of Ayurveda is available to us like a jigsaw puzzle. That is how I have always felt when I was doing work on it. A lot of pieces are missing and we need to place them. Some pieces may never be recovered again. We have to reconstruct and fill. But if we start making trying to solve the jigsaw puzzle, we'll get the pattern, we'll find the missing gaps, and we may be able to reconstruct and retrieve a lot of knowledge that was lost. Now, in later periods, it's also very interesting. Some of the textbooks of Ayurveda, they are very symbolic. Charaka means Charai Vedi. Brihatrai, that is Charaka, Sushruta, and Vagbhada. Charaka is a wanderer. Sushruta is the listener. Sushruta means listening well. And Vagbhada is the adept in speech. So these three textbooks even show by their names itself how knowledge should be compiled and presented. You should be open, you should wander. Sushruta Samhita says every corner of the earth should be searched to get new knowledge. And Sushruta says you should Bahushruta Shastra. Don't read only one science, read as much as possible. You should be a well read person. And Vagbhada says not only should you learn, but you should express it also very clearly. So Vagbhada means one who is adept in speech. So these three Samhitas together give us, the protocol for how to take Ayurveda forward. And then we had later textbooks dealing exclusively with diagnostics, pharmacy, pharmaceuticals, pharmacopoeia. So Ayurveda has been evolving with some solid foundations, some unchanging base, which we call as the tattvas. But the Shastra and Vyavahara can keep changing. And today, if we are to become, a leader in global process of integration, why I believe Ayurveda can be a leader in integration is, in the West, only Western medicine, modern medicine is legally accepted. Other systems have a non-legal existence. And Western medicine is trying to absorb the best elements in all this. So what we are going to have is a westernized, modernized, a modern medical system which has just taken whatever fits into its framework. But in India, we have a pluralistic healthcare system. Unfortunately, there is no integration. But the interesting thing is that in India alone, an Ayurveda practitioner or any traditional medicine practitioner has the absolute freedom to give the full scope of treatment. This is not possible in the US or Europe, where Ayurveda is practiced but under severe limitations. So India is the place where we can truly create an integrative model, showing the strengths of all systems, not just force fitting traditional medicine into the Western framework. We can show how each system is independent on its own. We can only have, I would like to use the word collaboration. And integration means assimilation. There is a power, equation there. One system is stronger, the other is weaker, and then one system decides what is best and to be absorbed. But here we have collaboration. There is no way modern scientific methods can fully understand Ayurveda or Ayurveda can fully understand. But in the interest of the patient, and this is an emerging concept of integrative medicine, where scientific evidence is one, it's a three-legged stool. Scientific evidence is one leg, clinical expertise is another leg, and patient perception is another leg. So when we bring these three legs together, we have a perfect framework for developing a new approach to integrative medicine. And I think India has the potential to be the global leader here. This is our strength, because it is only in India that we have such diverse, full-fledged systems working parallelly, like Unani, Siddha, Ayurveda, homeopathy, all of them bringing in different paradigms, and our culture has accepted them all independently. But what we fail to do is we fail to help them integrate. So the patients are, in India, integration is patient driven. In the West, integration is system driven. This is the big difference. And we should put this to a bigger advantage. We can create to the globe, we can give the message. And for that, our modern medical community and the traditional community have to come together. So I think this is a real vision for the future. Now, and you can see, it was a Dutch scholar who made a list of all the great teachers of Ayurveda, and it's a huge list. It would be a great tribute if we started highlighting each of these teachers and how they contributed. I mean, it's mind-boggling, the number of people who have contributed to develop this knowledge. We hardly know them. And the very interesting things are there which can inspire the new generation, even our own medical tradition, I mean doctors, that the first textbook of Ayurveda is actually the notes of a student, Agnivesha. Agnivesha was a student of a great teacher, Atreya, and his notes became the first codified textbook of Ayurveda. This shows that the whole medical education was student-centered. The whole idea was the student's knowledge should be one step more than the teacher. So this is a very progressive thinking. And we are big today, the whole Ayurvedic fraternity is looking at how to go back to Charaka or Sushruta. Whereas Charaka himself says, move forward. It's the student's work. The next student should take it one step forward. So this is a very profound message that even the classical writing of Ayurveda gives. Sushrutasam, all these textbooks are named that way. They are not named from the original source. They are named by the person who has edited it latest. Now, modern documentation of Ayurveda just happened in the pre-colonial period, and this is a big problem. We need also research leadership in Ayurveda. In one slide, I'm trying to compress this, that how Ayurveda was discovered. It's an ethic view, it's not an emic view. We still do not have an emic perspective on, how research should happen, how Ayurveda should grow. The Westerners started this movement in the colonial period. They started writing about Ayurvedic texts. They discovered, the rhinoplasty, plastic surgery of the nose, what drugs are used, and this set off a lot of interest. In the later periods, we have ethnobotanists studying, historians studying. Now we have modern scientists studying Ayurveda, and Ayurveda community itself is trying to, define research from an ethic view. What outsiders have told what should be done. There is no internal view of how research should happen. Whereas in the old tradition, you can see a very critical approach was taken to knowledge building. Some of the chapters in classical texts are just debates and discussions. And in Charaka Samhita, there's even an entire section on how to conduct a medical debate, how to, have a friendly discussion, how to arrive at truth rather than, engage in polemics and, inconclusive debates. So all these things, how debates can further medical knowledge, is very clearly documented. And there were differences of opinion between different schools of thought. And Charaka Samhita is perhaps contains a lot of such conference reports. I always think that the first World Health Assembly was held at the foothills of Himalayas, sages assembling together and pointing out, the world is suffering from a pandemic of diseases. What can we do to solve this? Where do we get the solution? So we do have an account of such conferences, meetings, and their proceedings have been, summarized in various chapters of these texts. And if you look at the knowledge building, this is what I am very keen on, proposing today, that there is an internal view of how research should happen. Ayurvedic textbooks say Aptobadesha, or the teachings, they are just the starting point of knowledge. You have to read them carefully, but then you have to do pariksha, or verification, through pratyaksha and umana, which are, actual observation. And then you get vijnanam. So the student is expected to verify, not to believe. And that verified knowledge has to be translated, translational medicine, yukti. It's a very interesting concept in Ayurveda, that the clinician becomes innovative. He just doesn't stick to what is there in the text, but creates his own innovations based on what he has verified, through his own experimentation. And then he creates new textbooks, and this continues. And here, interestingly, this is where Ayurveda departs. Ayurveda says everything is not possible through just sensory perception. There is atindriya also, there is intuition. You can use yoga, meditation also to access higher levels of knowledge, all that. So we have a very nice model of knowledge creation, which actually should drive future research in Ayurveda. We can use modern methods, modern research, but we have to integrate it. Zoopharmacognosy. Ayurveda says we still need to study from plants and animals, and they teach us a lot. This is called today zoopharmacognosy in a New Mexico university. So I'm just looking at the time. I've completed around 35 minutes. So is it okay to take 10 more minutes before I wind up?
Yes, please.
Yeah.
Go ahead.
So, in a New Mexico university, they found that the sparrows were, picking cigarette butts and putting it in their nests. And they got curious, and they found that the sparrows were doing this to prevent some pests from attacking the eggs. Now, what is mind-boggling here is that for a human being to even, have the slightest imagination that the chemicals in a smoked cigarette can repel a pest that is attacking the eggs, it would have taken hundreds or thousands of years of research. We would still not get a clue. But an animal or a bird like sparrow just looks at the cigarette butt and it knows instantly that this can be used for this purpose. And after smoking, some chemical changes happen with the nicotine inside, and that is what actually helps. So they discovered this. So humans have always relied on animals, to get the first clues in drug discovery. And this is something which is lost. Today we are in a crisis. Drug attrition, pharmacology, drug discovery is at the brink of a big crisis. We are not able to develop big medicines. And in the beginning of modern medicine, it was traditional systems. It was these traditional practices that actually inspired the discovery of so many new medicines. So we have to go back to our roots. We must get connected. Charaka Samhita says, go back to the forest. Learn from forest dwellers. They are your gurus. Learn from the animals. Atharva Veda acknowledges, oh eagle, oh mongoose, oh snake, you are our teacher because you have taught us so many things. We have to go back, and to nature if we are to confront this new crisis. And animals still self-medicate. And so that is how this branch of zoopharmacognosy has come up today. Now, even when coming to observation and experiment, these are three methodologies which I discovered from a classical text. We can clearly say that Charaka talks about reporting outcomes of clinical practice. Charaka says, if you treat a patient and if he gets better, it doesn't mean it was your treatment that cured. Diseases can cure by themselves. It's called, today we call it self-limiting. Charaka said, Vina kriya swasthyam gachada. Even without a treatment, patients can get better. So how do you know whether it's a treatment that really works? So he said, you have to rationalize. You have to report your treatment and discuss and with peers and establish that it was really, there was a cause and effect relationship. Otherwise, he says you are a quack. A physician who cannot justify or rationalize the outcomes of his clinical practice is, according to Charaka, a quack. Vina tarkena ya siddhi, yadricha siddhirevasa. So he says 5 people he may save by chance, but 100 he will kill without due to his ignorance. And then we have also observational study designs. Purvavat Sheshavat Samanyato Drishta, retrospective analysis of cause and effect relationship, prospective analysis, and also cross-sectional. So these are, I'm just trying to give a snapshot of, the direction that Ayurveda will have to take if it has to become contemporary or Yuganurupa, and then contributing to the creation of a global health culture. So a controlled study design. There are also discussions in our classical texts on how you control one group with treatment, one group without treatment, a positive control, negative control. All these terminologies are there. And as I mentioned, apart from these observational methods, intuition and higher consciousness, today we know serendipity is a part of medical knowledge discovery. Alexander Fleming discovered about penicillin serendipitously. So this is very much recognized in Ayurveda. There is no method to develop knowledge. Once you develop the fundamental insights, then you can, expand it. But how knowledge is discovered is sometimes very personal, intuitive. So that's also very much recognized. And another important aspect is the complete human being, body, mind, and self. In fact, in the West, integrative medicine is even today defined as an approach that integrates body, mind, and self. And Ayurveda was one of the earliest systems to call this Sattvamatma Shariram Cha Trayameda Tridandavat, like a three-legged stool of the human being, where we have to integrate three aspects of the human personality to achieve complete healing. And one of the biggest problems that have happened in modern times is the split between body and mind. And Ayurveda reminds us the body and mind is one continuum. The mind is as physical as the body. What you do to the body will affect the mind, and what happens in the mind affects the body. Today we have the PNEI axis, psycho, neuro, endocrino, immunology. Now this looks like a rediscovery of the ancient Ayurvedic model, Manas, Vata, Pitta, and Kapha. So Manas is mind, Vata is neurological regulation, Pitta is endocrinological regulation, and Kapha is immunological regulation. So the Ayurvedic model is, is echoed through this modern discovery of the mind-body axis and how the crosstalk happens, in this framework. Now, the basic thing in Ayurveda is all about how to help the body to self-regulate itself. The Tridosha concept, it's not about humus, bile, phlegm. It's a model, a dynamic model, non-linear mechanisms, biofeedback mechanism, how the body can, restore balance. And Ayurveda brings here the concept of homeodynamics as opposed to homeostasis. Modern physiology tells about homeostasis. Everything is going back to a rigid state of normalcy. The word stasis is not acceptable to Ayurveda because the body is not static, it's continuously changing, adapting, dynamic. So the Tridosha theory is actually a theory of homeodynamics, how the body balances itself and maintains, a equilibrium even as it is in disequilibrium with a changing environment, time and space. So this is something which also can give a new model of understanding the human body. And I think the last thing I will talk about is, I will not go into the details of these slides. In a nutshell, Ayurveda offers us a certain paradigmatical framework, which I think can bring a fresh perspective, a very inclusive, accommodative approach to future of healthcare, which in my opinion should be collaborative integrative medicine, not just integrative medicine. So first and foremost, we talk about personalized medicine. Ayurveda says first, nature first. Nature-centered medicine. If nature is not harmonious, there is no way the individual can discover health. We are part of this whole. So nature-centered medicine for the people living in a region, the medicine there. So it's Ayurveda is universal, but there has to be Indian Ayurveda, European Ayurveda, Russian Ayurveda. Wherever you live, the applications will be different. So Shastrarthan Vyabhino Vidyan. This is from the Kama Sutra, where they say the principles of Shastra are broad, but prayogams to Ekadeshigan. The applications are always local. So a global vision, but local action. That is what Ayurveda, advocates. And then we have person-centered medicine, where the treatment has to be, for each individual. Integration of lifestyle, diet and medicine, mind-body medicine, complex formulation. This is a very important thing. Most of the side effects today come because we are focusing on purified single molecules. Ayurveda tells us how, if you make a molecular cocktail instead of a single molecule. And the whole new science of pharmaceuticals has to be the science of molecular combinatorics. And this is a fresh perspective that Ayurveda offers. And then preventive, predictive medicine, and also healthy aging. This is very, very important, because Ayurveda says death is something which is inevitable. So the moment you are born, you should actually prepare for your death. You should learn how to welcome death, how to die in a healthy way, how to smile and pass away. Just like sunrise is beautiful, sunset can also be beautiful. So Ayurveda says, make your birth a sunrise and your death a sunset. Let people meditate when you pass away. So healthy dying, preserving cognitive function, it's possible. The Ayurvedic term for death is dehatyaga, or giving up your body. They don't call it death. There are two ways to die. Either death swallows you, or you give up your body. So you can anticipate that the final moments, living a full life, you can just bid farewell in a very dignified manner. So dignified dying is also a very important aspect of Ayurveda. So I'll just skip these slides, and I just want to point out that today we are living in a very technological world. So many people think that technology is against, Ayurveda is against technology. No. In Ayurveda, it's all about appropriateness and, balance. So we can find that in our tradition, we have some of the biggest and the most fascinating medical fiction stories. I would call it medical fiction because we don't have evidence that they actually did it. But you can see ideas about, artificial fertilization, cloning, and even, organ transplant, preserving dead bodies, restoring youthhood, all kinds of technological feats. And Charaka and Sushruta have also discussed a lot about, removing tumors, and how a malignant tumor and benign tumor are different. In a benign tumor, you have to remove the capsule. So all these technological feats, they also visualized. So I don't think technological development is against the spirit of Ayurveda. It's only when we become over reliant on technology, or abuse or misuse it in the wrong context, that is where the problem comes. So what we have here in Ayurveda is a very progressive, open, accommodative paradigm, which I think can become the foundation of future healthcare. So a meta framework for integrating multiple approaches to healthcare. But if this has to, so some of the salient features are, three-tier knowledge system. The whole is more than the sum of its parts. The idea of emergent properties. How about new properties emerging? We cannot study everything by reducing it to the parts. The focus on relationships and patterns, the systems view, non-linear dynamics, shift to the study of variability, why we must study variability than just averages. So these are all some of the salient features of this new framework. So I think I have used up my time, and I will stop here. For this to happen, modernization of Ayurveda has to happen, and this is a whole formula. I'm not discussing this because I think we need some time to discuss also. The modernization of Ayurveda is Yuganurupa Ayurveda, which is just a continuation of what it was doing throughout its evolutionary history, being fixed on its foundational principles, but being willing to adapt, accommodate, and also create new applications that are relevant for the time and place in which we are living. So with this, I conclude. Namaste and thank you.
Thank you. Thank you, Dr. Rammanohar, for that very enlightening presentation. Almost everything that you said was new to me, and it's really wonderful that you actually spoke about Ayurveda in a modern idiom with which perhaps we can relate, in the sense that you talked about technology, you talked about how the methodologies which have been talked about in the script, in ancient texts, they are very much scientific. In fact, perhaps even go beyond the modern scientific method, which very much uh, focuses on parts rather than as a whole. So I think I'll open this for discussion now with one or two questions of my own. Uh, One is that what you said makes sense.